Good morning, friends and family. I am here in the quiet, getting ready to introduce you to my esteemed guest for today. Super excited. Welcome to another Saturday morning coffee and conversation on the If You Could See Me project. Today, I am really excited to welcome my guest. I first wanted to just start off by recognizing that today is Juneteenth, and we all need to be recognizing Juneteenth every year. We need to be recognizing it, as a holiday, as was done this week by the federal government. But it goes so far beyond that. We need to recognize this as a day. But it's much larger than just a day. It's a part of our responsibility as American citizens to learn our history. And if we don't already have the inclination or the enthusiasm around learning our history, then, this is a new opportunity, a new window into what is real and true about racism in America, about the injustice and the inhumanity that has been a part of our fabric. And it is our responsibility to recognize that dark past, to learn about it, to commit ourselves to, reconciliation through action, through learning, through discussion, and to continue moving forward toward the world that we want to live in. And so today I am joined by Dr. Kevin Doyle, and he is, you know what, I'm going to bring him in. I'm just going to bring him in, and then we'll talk more. Dr. Doyle.
Good morning.
Good morning. So I just started to introduce you, and then I decided, you know what, I'm just going to bring you in, and then I'll start talking about you. Because you are many things. You are a counselor and a counselor educator. You are an advocate. You are a new dean of the Graduate School for Addiction Studies at Hazelden Betty Ford. But above all of that, you are my teacher and one of my professors from the graduate program at Mahone University. And I am so honored and excited to have you join me here today.
Well, thanks, Lauren. Lauren, where did I get that from? Erin. Thanks, Erin. And it's great to be with you. And I hope I can live up to all those titles. Those are daunting, so I'll do my best. And thanks also for recognizing Juneteenth. It's a particular honor to be with you on this day. And in fact, I Googled yesterday, what's the appropriate greeting? That's my own privilege. I didn't know the answer to that, and now I do. And I saw that it is appropriate to say Happy Juneteenth. So happy Juneteenth to any of our audience who are listening. And again, it's a great privilege to be with you, and looking forward to the conversation. And I have my coffee too.
Yay, coffee and conversation, my favorite thing. So happy Juneteenth to us all. Because as I said before, it is our history. It is all of our history. And we experience it differently, and we have a different experience of it, but it is an opportunity for us all to recognize a massive shift in our collective reality. Though policy-wise, maybe not in the hearts and minds of Americans at the time. And, change is slow, and change is hard, and change requires discomfort. And so before we signed on, we were chatting a bit about, I always ask guests before they arrive, what are you comfortable with? We'll talk about pretty much anything here. What's off limits? And what you said was nothing's off limits. We start with, discomfort means that we're getting into something important. And so let's start there. Let's start with discomfort. I had a conversation, or I did a talk a few weeks ago, actually, about racism and mental health. And my colleague and I, who were having the discussion, talked about the value of discomfort and how sort of in our world, in our professional world, discomfort is important. It's kind of part of the process. It's kind of the whole thing. And there were a couple of people who said, gosh, I never thought about therapy in that way. I never thought about it as like, it's supposed to be uncomfortable. And if you come at it from that perspective, it kind of changes everything. So talk to me about it.
Yeah, absolutely. It's funny, as you were talking, I was thinking about a training I went to many, many years ago, and some very well-meaning trainers who were counselors said that we're obligated to report illegal activity. And I was a newbie at the time, and I was thinking, they never covered that in my counselor training. And I'd be calling the police every session, because if you work in substance use, it's all illegal. I mean, rarely does someone only use a legal substance like alcohol, let's say, in a legal way, So then you've gotten into this area of becoming comfortable with things that people do when they have mental health or substance use, in particular disorders, because we have criminalized those areas. And of course, there's a whole, set of ramifications of doing that. So it's easy to think of our patients and our clients as, those people who do those bad things, and not to dig a little more deeply and say, well, why is that? Are there systemic issues that have led to that? Are there criminal justice system, which are systemic issues, issues? Are there issues within our health service delivery system that conspire against folks? And so we have to be comfortable. I've heard people in counseling sessions say some pretty awful things about what they did in their lives. And in my work as a counselor educator, as you know, part of what we have to do is help the new counselor, the new clinician, become comfortable with those things. Because when people have things like that in their background, what would we like them to do? We would like them to make some changes. How do they go about doing that? Well, maybe they enter into counseling, right? So let's think about something as very difficult as domestic violence or interpersonal violence, right? No one's in favor of that, of course. Those can be heinous things. But would we not want someone who is a perpetrator of that to seek help? Of course we would. So then that person's going to share that in counseling, and that person might share some pretty awful stuff, and yet that's the road to better functioning, we use the word recovery, of course, in substance use. And so the helpers have to be comfortable hearing those things and taking on some of those burdens, and not flinching, not further stigmatizing someone. Sometimes early on, I like to say that, and we've heard this many times, of course, in the counseling arena, that the best thing you can do is provide a welcoming enough place that the person comes back for the next session, because it takes, think how difficult it must be for someone to disclose to a stranger your deepest, darkest secret and flaw. That's asking a lot, and it takes a while to develop the trust and rapport for that to happen. And so yes, I went off on a little tangent there, but these are difficult and challenging things. And yet, if we want our society, our culture to be a better place, as you said in your lead-in, we have to figure out what's the role for helpers to play to facilitate that. And it's a challenging thing. And yet I've been so fortunate in my career to be around so many people who've made incredible changes in their lives and really become really productive, contributing members of society. And some of them have entered the profession themselves, which is even cooler, So those are some of the things that come to mind when you go down that path.
So many questions, thoughts, ideas come up, when I start to go down this path. in the description of this episode today, I talked about, this being getting ready to mark the 50th anniversary of the quote unquote war on drugs. And so, I think that the big conversation is, what is our role as helpers? Where do we bridge the gap between the micro and the macro? And how have you, as a professional, sort of developed whatever your philosophy is around all of that? And how do you, how has that evolved?
Yeah, gosh, that's a wonderful question. You used a word that I'm very flattered by earlier, and that was the word advocate. And, I think that that's one thing that has grown in my professional life, comfortability with advocacy, which is even a hard word to say sometimes, but and being willing to put oneself out there a little bit. And I've had some really interesting experiences with legislators. First of all, one of the biggest lessons, of course, is one that a lot of people have difficulty with, and that these are regular old human beings like the rest of us, and there's this sort of awe, putting people up on a pedestal. And I don't mean that we shouldn't be appropriately respectful, but we should be, of course. We should be like that to anyone. But these are normal men and women, or however they identify, that need to be hearing from people. Now, that doesn't mean it's always going to go well. I've had some very discouraging interactions with legislators. I'm thinking of one in particular. But still, one that really stood out in a personal meeting where I was really dismissed. But even that individual heard from an advocate. This was around barrier crimes laws in Virginia, where I am, and how restrictive those are. And Virginia has some really, really harsh barrier crimes laws that are not these are permanent bans. So if you have any of, I haven't done this research recently, but at the time, it's about 150 crimes on the barrier crimes list. And if you have any of these, you had a lifetime ban from ever engaging in a wide variety of professions, like working in the community mental health system. And there's something wrong about that when somebody can rectify or remediate their issue, be in really strong recovery, and have the potential to be an incredible counselor or clinician, and have a lifetime ban like that, for a crime that you might have committed when you were, 19 years old. And for example, hazing is one of them. And I don't mean to diminish hazing. That's a horrific thing. And yet, should someone who is convicted of a hazing offense at 19 be banned for life from ever working with people? And so that experience with a legislator didn't go particularly well, but others have. And where the legislator, I'm thinking of another time about a year and a half ago, where a group of us went to see, happened to be a Republican legislator, about a piece of legislation that would traditionally be something you would associate with Democrats. And he had done his homework because we were coming, and we came to the office all prepared, and he said, "I've done my research on this. You don't have to give your speech. I've decided to be a co-sponsor." This was our elected member of Congress. Now, first of all, good for him for taking our visit so seriously that he did his homework, and good for him for being willing to sign on to something that maybe wouldn't have necessarily aligned with his particular affiliation, his political affiliation. And so it was incredibly encouraging. And yet, if we had not gone to see him, I don't know that he would have done that homework or signed on. And it's very simple things, and that one was easier because 5 of us went. I had about 8 people who volunteered in his conference room here in Charlottesville, where I am, could only accommodate 5. I had to say, sorry, folks, I've got to cut it off at 5. And what an uplifting and encouraging outcome. So sometimes you have things like that happen, and other times you get the first experience where you're more discouraged. But even in that case, that legislator heard from someone who had a different viewpoint. And so I felt like I had done, fulfilled a little bit of my responsibility. And so advocacy is really important. And the last thing I'll say about that is that I have to be careful in this area, because the work that I've done recently over the last 10, 12 years has been with healthcare professionals who have developed substance use disorders, partly because they're human beings and human beings develop substance use disorders, but also they have access to powerful medications in their practice and sometimes divert those for their personal use. And where I have to be careful is I would like for all of them to become advocates. Now, that's not my role, right? My role is to be a counselor for them. And yet, advocacy can go hand in hand with strong recovery. And so I sort of gently nudge and remind folks that advocacy is important. And I talk about, because some of them have had to experience pretty significant criminal justice consequences. And I say, if you advocate effectively now, that person who's going to come down this path 10 years from now might really benefit because there's been some effective advocacy done by people like you. And you can see the wheels start to turn a little bit. And some of them say, I think there is a place for me as an advocate once my recovery is strong and stable. But again, I say, no, listen, that's not why you're here. But I think it can be a component of your ongoing recovery is to move into the advocacy realm. And there's no more powerful advocate, I don't think, than someone who's been through this personally. Legislators and people in the media love to hear the personal stories. I love to hear the personal stories too. So advocacy is sort of what stands out from what you asked for me.
Well, I appreciate that so much. I started in advocacy. I started working in the field of case management and evolved into therapy. But the very first experience that I had as a helper was helping people to become self-advocates and advocates for their family members who had disabilities. And what I learned from that was that there is so much healing and empowerment that comes from learning to tell your story and learning to use your story and make meaning of the incredible difficulty that you have experienced in your life, all of us, through that process. And, so as a narrative therapist and also as someone who identifies with the feminist, orientation, I see it as one of the pillars of, healing is, using your story in a way to make change. Obviously, we don't tell people that's what you have to do. We don't prescribe that, but it is not something that I've ever seen go wrong. In terms of when a person is ready to do that.
It's so powerful. Yeah, I agree. And I love also, as you know, Erin, I love the group format. And it's sort of implied, if you're sharing your story, you're sharing it with somebody, maybe an individual counselor perhaps, but usually that's in some sort of group setting. There's an audience, there's a group, whatever it might be. And, it's really therapeutic. And then what you get back is usually so much acceptance and support. And, we'll even use this word love, I again, working with healthcare professionals, I've seen this. I've done a fair amount of work with college students too. And we are at Hazelden and Betty Ford, our graduate school is a new member of the Association for Recovery in Higher Education. And when you see a college student, return to school and think, wow, I don't know how I'm going to navigate this environment. College campuses have been called recovery hostile, and walk into a room of other students in recovery and the relief, like, wow, other people get it. it's not just me. I'm not alone, and yet you have to take that risk sometimes to share your story. And then when they share their story and get a lot of nods and sort of laughs, in a good way, and knowing smiles. Oh yeah, I did that too. They might even know the same magistrate or the Commonwealth's attorney or whomever. I mean, they can sort of say, yeah, I had to deal with that person too, and just support one another. And so it all starts sort of with that willingness to share, to take that risk of sharing your story, and helping professionals. Our role is to create an environment where that can happen safely, and then stay out of the way, shut up, let the magic happen, and you do this in your work with the importance of narrative and storytelling, and you don't know what's going to happen. I when I started at Longwood, I remember going to a meeting of the student affairs staff and talking about college students in recovery. And when you talk about people in recovery, you get a whole range of, reactions, nods of understanding and fear, stigma, judgment. Those things exist. And you never know. And so after I talked a little bit about this, I was a new guy, so nobody knew me. A gentleman came up to me afterwards and said, anything I can do to help, I'm all in. And he was the chief of police. The chief of police. It was awesome. I'll say his name, Bob Beach. He's on Facebook. Who knows? He could be listening today. And I felt so supported. And that's not normally who you would expect, to be. And so we have to be careful with law enforcement too, because, I'll be the first to say that there's a need for really deep look at how we do policing. And yet there are certainly some law enforcement officers who do get it. And this was one who really understood. And he would seek me out whenever he would see me on campus and say, how's that going? How's that recovery program going? Can we help in some way? He would invite us to come talk to his officers every year, so they were aware that there were resources. And, but again, so going back to the point, those things don't happen unless you put things out there. And sometimes the things you put out there might be a little bit uncomfortable, Again, that sort of ties all together from your opening, And I think as you get deeper into your career, you become a little more comfortable taking those risks. And so if there are younger professionals listening, I would say have the courage to take some risks earlier, don't play it safe. And put those difficult things out there, and you'll be amazed at what will come back.
It's such a powerful statement because all of this requires a lot of courage. So it requires courage for people to show up in therapy. Requires courage for people to advocate for themselves and learn how to do that. And, my dad, I've shared this in this podcast numerous times. My dad had this motto. He was always an entrepreneur and a business owner, or, had a managerial role or a leadership role in wherever he worked. And his mantra was, don't ever ask anybody to do something you're not willing to do yourself. And so if we show up as helpers without a willingness to be uncomfortable, then we cannot expect that from the people we are sitting across from. And so, and obviously we have to develop skills to not make our discomfort present in the room, right? Like we have to do that work outside of that space. But there is an enormous amount of value in, and again, I will tie this back to the very beginning. There's an enormous amount of value in discomfort. And sort of the foundation of where I think we can go collectively as humankind is to develop these skills and to get more comfortable being uncomfortable. And so when you talk about, you know, creating that space and then getting out of the way, I do think it can be the hardest thing to do, because professionally, we show up wanting to do something. And very often what we can do that is most powerful is not in what we say necessarily. It is in the work that we do outside of the room. It is in the work that we do getting comfortable with the silence. It is in the work that we do in allowing people to be in discomfort themselves.
Right, right. Yeah. You know, change is hard. And if it wasn't hard, you know, if it was easy, you wouldn't need to pay someone, or for your insurance company or Medicaid or whatever, to pay someone to help with that. So that's where we come in. We have to remember that, and you used a great word in the story about your dad, which was become willing. We have to be willing to do that. Doesn't mean we have to actually do it, because it might not be appropriate for us to do it. Right. But were I in those same circumstances, would I be willing to do what I'm asking this person to do? And that's a good way of looking at it. I remember when I was in my doctoral program, the doc students facilitated a group counseling class like the one that you took, and the master students were the clients, and they were not particularly engaging one day in group, and I said, what's going on here? And they said, well, you know, you're asking us to share things about ourselves with people that we know. And I said, well, think about what we ask our clients to do. We're asking them to share things about themselves with people they don't even know, you know, with complete strangers. Now, I guess there's some freedom in that in some ways, but, you know, I really tried to challenge the students that day that, you know, what we're asking of our clients is hard. And I'm not saying to have a pity party. We do have to, you know, hold people accountable and have expectations for folks, of course. But it isn't easy, and we have to recognize that you know, I also think back to my earlier part of my career, which has almost all been in the substance use arena in one way or another. And back then, you know, this was in the 80s and 90s, we used to routinely dismiss people from treatment. The phrase is kick them out, right, if they use substances. Well, you know, that's what happens with this disease. You know, it's a chronic relapsing disease, like a lot of other chronic diseases. And again, I'm all for having standards and boundaries and accountability. And yet, if someone relapses, that's demonstrating the need for a higher level of care, not dismiss you from care. Right. And to our credit, we changed our policies around that. You know, David May-Lee, who's a wonderful theorist around substance use, and I would recommend his work to anyone. Just Google him. He has a monthly free newsletter, which is great. MEE-LEE, David May-Lee. You know, he talks a lot about this, you know, adjusting the treatment plan, you know, not dismissing someone from care. So that's part of what I think about as well when you lead us in that direction.
I'm typing David May-Lee in the chat for anybody who think I spelled it right. Nope, I didn't.
MEE-LEE.
Yeah, and I left off the last E, so I'll change that. I do think people will be able to find him from that. So talk to me about, or all of us, I guess, you know, because you do, you know, I'm new here, about the value of sort of evidence-based practices and changing the way we do things. You know, when we know better, we do better. How have you seen that both effectively and ineffectively sort of play out throughout your career? And where do you think that, how important do you think that is?
Yeah, that's a great question. And it's certainly something that we talk a lot about at Hazelden and Betty Ford. And I'm really fortunate that I'm the dean of the graduate school, but I'm in an organization that is, world renowned for treatment. And that's a huge passion of mine. And one of the things that I'm trying to do in my new role is to sort of bridge those two and make sure the connections between our graduate school and our students and the treatment side are really strong. We've got lots of, it's great to be on a campus where you can say, yeah, you're going to be going to your internship later, and it's right over there in that building. It's all housed together, and we have locations around the country. But for example, in Minnesota, it can work like that. So evidence-based practices are really important, but there's a but to it too that I'll get to in a second. So when I started, and again back in the 80s, I feel like the old guy, but there was a lot of do it the way I did it. It was a little bit fly by the seat of your pants. The workforce was back then really significantly, as in well over half, based on the data that I saw then, people in recovery. Now, people in recovery are an incredible resource, and there wouldn't be a workforce if there weren't folks in recovery. But the problem was some of those folks really hadn't undergone any training to do this work, and overshared their own personal story, for example, or had difficulty with boundaries, which are challenging because you may see clients in self-help group meetings, and how do you navigate that, when you also have a professional relationship with that person. So back then, I think there was not as much science behind addiction treatment, mental health treatment in general, as maybe there needed to be. And so a number of different techniques and practices emerged that became data-driven and validated empirically to be shown to be effective. Motivational interviewing, for example, is a good one. However, and here's the other but, as a counselor, I believe that you can never take the individual out of the relationship. And so the challenge with evidence-based practices, what are sometimes called manualized practices, is you're not just following a script, because that de-emphasizes the individual. So it's not, if the client says this, you say this, and we could go off on a complete tangent, but I'll just recognize that there are really interesting things happening with bots and artificial intelligence, providing services. And I'm a little skeptical about that, but I have to remain open to new practices, but we'll leave that for another podcast. But so I believe the individual and the relationship between counselor and client is really crucial. So I think the challenge then is to learn from what the data tell us. What do evidence-based practices say is effective? But also remember that if we can establish a rapport and a trust with our client, to me, that's the most powerful variable. And so I try not to think too much in the work that I do with people about, what are the correct words to say, but trying to be authentic and genuine and be a good listener and meet people where they are. And I don't know if you can manualize that, so that's the challenge. How do we take the best from both of those worlds? And then for me, of course, in my role as a dean, how do I help our students to learn how to do that, whether they're in recovery or not. And so, we try to expose them to lots of different approaches, because each of us has to figure out, how are we going to work effectively with people, Last thing I'll say about that, my first job was in an inpatient residential unit for adolescents. And my office mate, he worked the evening shift and I worked the day shift, was a gentleman named Carlton. And for my first year, I think I was trying to be Carlton. And then I realized that, and he was really good. And I realized that I can't be Carlton, I have to be me, and I learned some things from him that I could integrate into my own style, but ultimately, I had to do me. And you can't really manualize that. I can't train another counselor to be me, So it's a great question you ask, and sort of navigating that and pulling the best from both sides of it, I think, is the challenge ahead of us.
I was in a training a couple of days ago, an online training with Sally Spencer Thomas, who is just this incredible suicide prevention educator and psychologist, and just amazing advocate. But she's also really straightforward about what she calls the ineffectual nature of what she calls clipboard counseling. Like, you can't put, an acrostic or a mnemonic device on a clipboard and just checklist your way through a session and expect to get have an authentic connection with another person. We don't, and I always kind of go back to my experience as a performer, because so much of my education has been in the function of, occupying a stage and putting myself in that super vulnerable position. And it is very vulnerable to be a therapist across from a person who is in need and who has come to you as a function of your education and your ability to do this thing that they need help figuring out. And it reminds me of, all the times that I was afraid of going off book, whether it was a play or, in performing as a singer. And, very often I have my music stand on stage and I can rely on the lyrics. And it is only when I close the book and step away from the music stand and, fully commit to showing up and figuring it out no matter what happens, that I have the best, most authentic experience on that stage. And the exact same thing happens in a, therapeutic session when I just close the book or put away the clipboard or whatever it is and just sit across from another human being and trust that I have been educated and that I do know what I'm doing, and that there will be times when I have to show up without a script, not necessarily knowing exactly what to say. And and I have to be okay with that. And I think that separating yourself especially as a new clinician, can be so terrifying. And I have so much empathy for people. Like, I'm old. So, I started doing this as an old person. And I realized that that's relative, and it's hilarious that I say that because, I'm not old, but I'm much older than most of the people who were in my classes with me at Longwood. And so I felt so much benefit from having that life experience behind me. And so how do you as an educator, what's the word, like, create that environment for that life experience to help young therapists be prepared?
Yeah. Well, let me come back to that part of the question, because I want to comment on your wonderful analogy of going off book, because I really like that, and I haven't heard it phrased exactly like that before, but I think you're exactly right. I think the key to that is doing it with intentionality. Otherwise it's going off on a tangent and you don't even know what you're doing. And so I might say to a client, and I like to take notes during sessions. It helps me remember things, and I might write a note to myself, come back to this, let's say. But I might say, I want to talk about something you just said, sort of like what I'm just doing now with going back to your thing about off book. I think that's when some of the best work can happen, and it's organic in nature, but you have to do it intentionally and be aware that you're doing it, and know where to come back to if it doesn't lead in a productive way. But I can't think of a better word than organic. It happens in the moment. And so you can't really plan a counseling session. You don't know what the person's going to say. And I like that clipboard analogy too that you used with the previous guest. In terms of, creating that type of an environment for students, I think, it starts with really beginning with the basics, and some people have natural tendencies that they can capitalize on. I think some people are better listeners than others, and some people are more patient than others. Some people are more accepting than others. But I think most of those are skills that you can learn and improve upon. I think I can always improve upon those things, So I'm not saying that anybody can be a helping professional, but I think a lot of people can learn those skills. And so you start from that. And then sometimes it's more a question of what not to do rather than what to do. And so, really a basic starting point from any kind of counselor or helping professional training program or educational program is understanding that this is not advice giving. We don't tell clients what to do. There are probably plenty of people already telling them what to do, family members or, the criminal justice system or whomever. But it's more helping them get to a place where they can come up with some strategies to move forward. And so, I happen to identify as a person who's not in recovery. I'm fortunate that I don't have a substance use disorder, although, to my knowledge anyway. Although I joke with people sometimes, sometimes I feel left out because there's something magical about that community. And folks in recovery shake their head and say, no, you don't. You don't wish this is something you had. But for those in recovery, helping them to understand that their personal experience can provide a lot of passion for the work, but maintaining an appropriate boundary from clients or patients and not oversharing about that is probably a good strategy. And so how do you use your own personal story? For those who are not in recovery, how do you use empathy to get to a point where you have some idea of what this must be like, and that applies to whatever condition you're working with. I really react against people saying, you use that great word willing. You don't have to have been through it. You don't have to have had schizophrenia to be effective in treating that, or any other mental health disorder. You just don't. But there's something we can't quite know either. And so with substance use, I'm so fortunate that in my early career, I was that guy who drove the van, with the patients to the AA and NA meetings. And I don't know if they were paying attention, but I sure was listening in those meetings. And I was also counting them to make sure somebody wasn't sneaking out the back door, smoke a cigarette or whatever. I joke that if you work in inpatient or residential programs, the most important skill is being able to count the number of people, make sure everyone's there, especially with adolescents. But anyway, I sat in those rooms and I listened and I heard the stories of people in recovery. And even though I don't identify as a person in recovery, I think I know 12-step recovery in particular pretty well, but not from reading a textbook or sitting through a lecture, but from being in those rooms. And I sign that, as an assignment when I teach those classes. Many meetings are open to anyone who might like to go. And for a lot of students over the years, it's been the first time they've ever been in a setting like that. And so that story, being willing to do something. So if we tell our clients, you need to go to AA meetings and try them out, let's say, would we be willing to do that? And as a student, I had some people that was really outside folks' comfort zones. And yet most students were able to do it and learned even from going to one or two meetings. And I've been to hundreds probably. Again, kind of a rambling answer. So, and I don't necessarily mean to divide it into two camps, but in substance use, there is a real, interesting combination of folks who identify as in recovery and what that's looked like for them and how they can use that to become good practitioners combined with the education that we would be providing in a master's program. And then folks who are not in recovery and maybe are drawn to this for whatever reason. It could be they have family members, or it could be that like with me, that's not really my story either for family members. It's really just once I heard the story of a few people in recovery, I was hooked, and so I think part of the educational process is trying to expose people to lots of different types of experiences like that so that they can be effective in the work that they do, and also ethical and safe practitioners.
Thank you for that. So as we near the end, there is like a pretty significant echo. I don't know if you can hear it.
No, it sounds great on my end.
Okay, good. So I'm just hearing myself back, and I'm glad that you can't hear it and it's not distracting to you. You have modeled the answer to the question that I'm getting ready to ask, both in the time that I have known you as a person and as an educator, but also here today. But I think that recognizing the times in which we live and presenting us with opportunities to be really honest and put all of the things out on the table. You are a white, cis, heterosexual, Anglo-Saxon man, highly educated, in positions of leadership for quite a long time, who does not identify as a person in recovery. Okay. So I think historically in our world, all of those things have been a privilege, a benefit to you. Now, as our world has evolved pretty significantly, and we are, asked to recognize our privilege and expected to, and also to create spaces where all people feel safe and affirmed in their identities and intersectional identities. Your position as all of those identities that I just kind of highlighted can make you potentially feel like an unsafe person to someone who might walk into the room. So how are you showing up to that reality? I know because I've experienced it, but I also want to talk about it openly.
Yeah. Gosh, great question. And I agree with all those characterizations that you put forward of me. Recognize that. You took a while to get to the word privilege, but that's the word. And I own that, I absolutely, I'm very much a privileged person, a fortunate person in many ways. That's such a complex answer, and I'm also conscious of time, so I'll try my best to hit a couple of things that I think are important to me. We have to listen. We have to listen. People of privilege need to listen, and not talk so much. And if there's some former students on here listening, or who listen at a later time, they'll probably laugh because I do talk a lot. But so I've been really trying to work hard on listening to people. But you also can't just assume that people, feel safe to share certain things about themselves or what their experience has been. And so again, I think you have to take the risk to ask those questions. What is it like to be you? Have you experienced racism in your life? Have you experienced oppression, marginalization? What has that been like? And also to recognize and understand and accept that you might not get back the answer that you want, that like, no, it's been okay, or no, never experienced that, so I read White Fragility recently, and so one of the things I've been trying to do is continue to educate myself, whether it's reading that we do, lectures we attend, webinars, podcasts, whatever, recognizing that we may be in a position of privilege, but to think that we understand other people's lives and realities is you know, pretty ridiculous, you know. But I think what I'm hearing from BIPOC people who are experiencing oppression or racism is that listening is great. I knew this clock would go off right in the middle of when I was talking.
I can't even really hear it, honestly.
But it's also time for action, you know. So what are we doing to dismantle systemic barriers to people, you know, whether it be voting or access to care or access to education? And not to give a big plug, but we have some scholarships at our college, the master's program for people in the BIPOC community. We have some scholarships for people in the LGBTQ community. And again, I don't say that in a way of saying, look how great we are. I'm saying that, are there things that we can do actually, not just talk and listen, but actual, you know, actual action? We're being called to that too. Do we show up? So not having the arrogance to think we have all the answers, you know, listening to people. How can we be part of some solutions? How can we be anti-racist, you know, and what needs to be done, you know? And I'm not saying I'm a superstar in those areas, you know. I'm trying to have the humility to understand that I need to learn better how I can be part of solutions as opposed to perpetuating those systemic barriers that have been around for, you know, generations. And recognizing that we're going to make mistakes, you know. We're going to say the wrong thing. White folks have to know that we're going to say the wrong thing. We are. It's just going to happen. The only way not to is not say anything, that's no solution.
Also wrong.
Exactly. Right. So accept it, you know, and ask for grace, ask for forgiveness, you know. That's a small, you know, a small price to pay, you know, the uncomfortability of, oh, I said the wrong thing one day, you know, people will work with you if you have the humility to say, I messed up. You know, I was teaching class a couple times, a year or two ago, and we're talking about the phrase predominantly white institution. And I was familiar with the phrase, but I didn't know what it meant. And when I talked about what I thought it meant, I realized as soon as I said something that was wrong. And I said, you know, I think that was a real microaggression there. And some people don't like that term microaggression, but at the time, that was what I said. And students appreciated that I owned that, you know, and I learned from that too, you know, that if you acknowledge some of that, people will give you the grace, you know, in most cases, or maybe they won't, but that's okay too, you know. So this is, you know, it's hard work. It's uncomfortable. That tells you it's probably worth doing, you know. That was from our chat from, you know, before we started. So, but yeah, I recognize that I have all those outward, you know, vestiges of privilege that you named, and thanks for calling me out on that. And,
sure.
You know, you know, that we just have to start somewhere, roll up our sleeves and just start trying to be part of moving forward, as you said earlier. So,
thank you for that. I'm a big fan of, you know, sort of naming the thing and of not pretending like things aren't there, or that, you know, we don't recognize them. You know, it is Juneteenth, and I have a white man sitting here across from me on this show. And so, you know, I want to acknowledge all the things, all the complexity that we face right now, and turn every conversation, especially in this space, into a conversation about important things. it would be really easy to sit down and have nice, pleasant, and I think this has been an awesome, pleasant, wonderful conversation, but there is a certain expectation that when you show up to If You Could See Me, you're gonna have the real talk, and we're gonna say the things that maybe we don't talk about in, polite society, because we don't know necessarily where people stand, and it is difficult to ask people, hey, let's talk about your privilege, right? Because a lot of people get really personal about that. And so if one person can sit here and watch this or listen to this later on and hear us have this sort of very candid conversation in which we recognize our privilege, and we we can have even if it's clumsy, a conversation about it, and recognize our responsibilities to ourselves, to our profession, to the people that we, are in leadership roles around, and to the world, because I am nothing if not enormous in the magnitude of my expectation of myself and my work. No ego there. I just think it's valuable and important. So, but it takes two people who are willing to do that. Otherwise, it's painful to watch. And so, I had to bring up the difficult thing, and then you had to be willing to meet me there. And I value and respect you for doing that. So thank you.
Well, thanks. These are hard things, but as the more we do them, the better we'll get at them, like with anything else. And, it will stumble along the way. And I knew somebody one time who liked to use the phrase "struggling forward," and I've always liked that phrase. And there's not one answer to these things too. So I'll be in Minnesota where George Floyd was murdered. And I was listening to a podcast recently or reading something where somebody said, why did it take George Floyd being killed for white folks to reach out to people of color, in their lives, and I did that. I called several people in my life, Black men, I guess they all were, after that happened. But I thought, well, would it be better not to have called them? That's what I did, and I probably should have been doing that all along, but what can I do moving forward? And so in an intentional way, I reached out to several people and had great conversations. And one of them said, I so appreciate your calling, so, could we be criticized for that? Of course, own it. Right. Yeah. I should have called you 10 years ago, but I didn't, I can't go back and redo that, but I can redo going forward, not redo, but, and make different choices. Right. And that's growth. And I own that. If you want to be critical that I didn't do that before, great. I'll listen and try and grow from that. But it's led in some good places. For example, a lot of folks are talking now about when you have panels, panel discussions and the representation, there was one famous, I don't remember the name of the conference, but a panel discussion on women, and it was all men. It's like, oh my goodness, or panel discussions on people with disabilities, and there's no one with a disability, and so I've had panel discussions in my classes where I bring in people in recovery. Now they're all in recovery, but they have usually been all white. And so last fall, in an intentional way, I reached out to people of color, make sure that this wasn't an all-white panel. Shame on me for not having done that before, but I'll do that going forward, and it was so enriching and so much of a deeper discussion because it was a different experience that this Black male had in recovery than the white folks had. Again, I own that was the blinders, or I hadn't been intentional enough about expanding my own, network. And was it uncomfortable? Did it feel like tokenism? Sure, but it still was the right thing to do, that's all we can do, is to strive our best going forward, to do better than we did yesterday.
It's it's interesting because I frequently have this this conversation about, not necessarily about racism and representation, but actually more around within families. Because what you often have is a parent or a family member showing up later in life and saying, I've evolved or I changed, and wanting credit duly for the work that they have done now, while also being uncomfortable with, being held accountable for the pain that was caused in the past. Right. And so there is this really valuable, we could probably have a whole nother hour-long conversation about this, and we're not going to right now. But the idea that, that's where our responsibility, as in my opinion, as white people lies, is both doing differently, right? And also acknowledging that while my intention wasn't necessarily to cause pain in the past, I was doing the best I could with the information that I had within my world. And that caused harm. And learning to sort of navigate the duality of that. I did not intend, I do better now, and I caused harm. That's a hard sort of place to sit.
Yeah.
So,
and yet we can't feel sorry for ourselves either.
No.
Because where our brothers and sisters of color have had to sit is much harder than that.
No question. No question. And so, that's why it's important to talk about it, right?
Yeah, right.
There was something else that you said that I wanted to respond to, but I don't remember now because I didn't write it down because I was trying to stay present. And I'm immensely grateful to you for showing up here today and for having this conversation with me. What do people need to know before we end?
Well, I'll just give a quick plug for our graduate program. We have about 180, usually 180 to 200 students, all studying for their master's degree in addiction counseling. Hazelden Betty Ford Graduate School of Addiction Studies. As you said at the beginning, we have an in-person program on campus in Center City, Minnesota, which is about 45 minutes northeast of the Twin Cities. And then we have an online program, which has 2 residencies where you come to campus for a couple of days, but primarily is online. We have folks from around 30 states right now doing their master's degree in that manner, which we've all become more comfortable with during the pandemic. If anyone out there feels a calling to perhaps continue their education and get a master's degree, work with people with substance use and mental health disorders, we would certainly love to hear from you. You can just Google Hazelden Betty Ford and you'll find the information on the website. And then we also have a lot of scholarships too, which is unusual for master's programs. There's scholarship money available for undergraduate programs in most places and sometimes for doctoral study, but master's level scholarships are somewhat unusual. And so not all those end up being awarded because, people don't apply for them or know about them. So that's part of what our mission is to continue to meet the workforce needs in the middle of an opioid epidemic and an addiction epidemic in general. The need for qualified workforce is greater than it's ever been. And so if that's something that any of your listeners are interested in or know people who might be, send them our way and we'd be happy to talk with them. And I'm grateful to you, Erin, for providing this opportunity. You expressed your gratitude to me, which is certainly appreciated, but I really have enjoyed our time together and have enjoyed following your career and the work that you're doing. So keep up the great work, and thank you for spending some time with me and having some coffee and conversation on a Saturday morning.
Absolutely. Thank you so much. you know, when I graduated, you told me to call you Kevin, but you'll always be Dr. Doyle to me. So in my heart and in the hierarchy of my, you know, educational world, you know, I've learned a lot from you. Thank you. I wish you all the best in Minnesota. And hopefully we'll have a chance to talk again.
I hope so too.
Everybody, thank you for joining us. As is often the case, I'm never a week ahead of myself, so I don't remember who's on with me next week, but it is inevitably amazing, and we always have wonderful people and incredible conversations. So thank you, everybody, for joining us, and I will see you again next Saturday.